Up next is Dr. Phyllis Whitehead, who is from Virginia and is going to address a very complex area, one that is in dire need of a framework, especially in light of the kind of data and material that Jeff just presented. And Dr. Whitehead has worked as an ethicist for many, many years now, has a wonderful CV and background, very academically oriented, hails from Roanoke, Virginia. And I'd like to go ahead and introduce Dr. Whitehead and let her take over the microphone at this point. Dr. Whitehead.
Thank you, Dr. James, and thank everyone for this opportunity to be with you today. As mentioned, I am a clinical ethicist and a palliative medicine clinical nurse specialist at Carilion Clinic, as well as an associate professor at the Virginia Tech Carilion School of Medicine in Roanoke, Virginia. Next slide, please. So the objectives of my presentation today are to identify some key ethical principles and considerations, as well as discuss an ethical framework in determining how to more effectively deal with disasters. Next slide. I like to start my presentation by framing what I think we all would agree would be one of our goals, and that is to establish and foster a moral community among all of us as healthcare professionals, as well as with our communities. And so when I refer to moral community, I am referring to our moral obligation to act on behalf of and be responsible for each other. And in particular, be mindful of the effects of disasters and climate change on the most vulnerable of us within our community. Next slide. And so let's jump in. So what are some of the principles that we want to really be aware of? I think part of it is harm reduction and benefit promotion. So of course, when we're looking at emergency preparedness activities, we want to protect public safety and health and well-being while we're minimizing the extent of death, injury, disease, disability, and suffering. So it really becomes a balance, right, of weighing harm versus benefit. Easier said than done, but most certainly I think is a core principle that we have to continually consider and remind ourselves as we proceed. Next slide. Now, the challenge, of course, it makes sense with public safety, but how do we balance our liberties and human rights? And particularly, how do we respect equally between liberty, autonomy, and the dignity of all persons? I think this is incredibly an important principle to be aware of, and to at least to give a moment of pause here, is that our country is founded upon our liberty, right? We fought for our right from, to the foundation of our Bill of Rights and from the beginning of our country. So these are grounded in our principles. And I think we see a lot of these principles playing out and continue to play out in how we respond to disasters and including climate change. Next slide, please. Distributed justice is an important principle for us to consider as we're looking and weighing the benefits and burdens imposed by disasters and emergencies, as well as our need to cope with effects. And this goes back to Jeff's presentation of how do we do this fairly and equitably when we know that we have a history of not doing this well, of discriminating and the bias that comes into play. So back to who's the most vulnerable? Who are they? Where are they? What are the special considerations based upon the particular emergency or disaster that we're confronted with? And I think that Jeff did a really nice job of summarizing the social vulnerabilities that we see all the way down to just where we live geographically, to the power grids of how we can pull that into play. Next slide. And we've talked about, and I know you've heard about through with other presentations, how incredibly important it is for public accountability. And as we make our decisions to be inclusive of the communities that we're serving, as well as in ensuring the most vulnerable are represented, to be transparent in how we go about making our decisions, and to have ongoing communication and consistency, all of which really foster and sustain public trust. And when we lose public trust is when we lose that ability to be able to effectively and safely care for our communities. Even though we know exactly what the right thing to do, if there is a lack of trust, people will not seek it out. They will not trust us. Next slide. So as we build community resilience and empowerment, particularly when we look at our principal goal of emergency preparedness, it is incredibly important to go to those communities to be able to talk and to be able to have representation of those that are the most vulnerable and the most disenfranchised, the most marginalized communities. And also to look at a more long-term goals of building more hazard resistant, promoting that recovery and healing that will occurs in our communities when disasters occur. Next slide. So what's our obligation from an ethical perspective, a moral perspective, from a public health professional obligation? And most certainly is to continue to build and promote our competency and understanding what the inequities that exist in our communities, to acknowledge our bias that are implicit that we come to the table with, and to continue to work through that and to coordinate among other professionals that we're in this together. Next slide. Additionally, not only from our professional obligation, we also have a civic obligation and response so that we promote that sense of personal responsibility and citizenship, not only within ourselves as a profession, but also among our communities and among others. Next slide. So, transitioning into some ethical questions that we can consider in order to build an ethical framework as we work through these incredibly complex situations. So what are the public health goals of the proposed program or activities? Seems such a basic question, but I think sometimes they're not well articulated or disseminated. So being able to do that and to talk about how effective the proposed program is in achieving its stated goals, and to be transparent about, has it been shown from the evidence to be 50% effective, 60%? What are the gaps in the program so that we can be able to more appropriately discuss that and to, once again, show that transparency? What are the known or potential burdens of the program? Sometimes I think we maybe step over this, we miss this step, or we minimize the importance of that discussion and sharing. And that helps us in then, of course, preparing for how we're going to address those burdens. Next slide. Additionally, other questions to be considered along with those burdens: how can they be minimized? What are some examples of alternative approaches or options that should be considered? Of course, it's important as we look into and consider the most vulnerable of those in our communities, is how is this program being implemented fairly? And if not, how can we promote more fairness in the program and the activity? Balancing how the benefits and the burdens of the program can be fairly balanced is incredibly important as well. So really looking at this from an equitable perspective of the program and activities. Next slide. So what are a few ethical values in being able to truly incorporate these ethical questions? Of course, fairness. We keep going back to how can we be fair? How can we be just? How can we ensure who receives what and at what point? And what is the rationale between that we came up with from an evidence of who's going to get it first and at when. Our professional duty, of course, dictates that we do no harm and that we not abandon those. And how do we do that? How do we fairly and safely do that? Not only from the communities, but also for we as professionals to ensure our safety as well. Stewardship is another ethical value that I think is important to talk about. During disasters, resources are scarce. How do we allocate them appropriately and fairly? And of course, Unitarianism is how we use this so much. It drives and us to be able to determine that right course of action based upon the greatest good. But what happens to those that are not part of the greatest good? And how are we balancing if they're not getting the same resources or those scarce resources that others are? Next slide. So in summary, it's important from an ethical process of element to really look at transparency. I cannot emphasize the importance of communication to all the stakeholders, to all of the healthcare professionals. We tend to work in silos, that there's lots of great efforts that are occurring, but not collectively and not in collaboration. We have to be consistent, that we treat like groups the same or at least similarly, and that we really start to address the social injustices and the discrimination that historically has ridden us as we respond to disasters. We must be able to provide proportionality to ensure that we elevate our response during the crisis appropriately. And not dependent upon the area, the geographic, that those who are the most marginalized are unable to get the resources that they need in the moment of the crisis that they need it. I would like to just propose one moment of even the difficulty of when we address race. And I've been seeing a lot in the literature regarding race isn't a man-made artificial term that really doesn't have a basis from a biological perspective. Now, yes, there are biological differences among us from an ethical background, but race, the term, is a man-made product that brings bias and implicitly infuses bias into anything that we address in that term. So being able to just be mindful of our words and to be aware of the fact that our biases truly are here and recognizing them, not to say that we lack bias, because we're human, we all have the bias, but being honest about that and mindful of it. Being accountable to ensure that our duty is to respond. And I think this brings me back to my first statement about moral community. Is this accountability that we all have to foster a moral community, that we have a moral obligation to act upon on behalf and be responsible for one another, and particularly the most vulnerable within our communities as we respond to disasters. It is important that we ensure the public safety and that we can do this in a mindful, ethical, and moral way. Next slide. This is my contact, and I made up for 2 minutes of the presentation. I'm looking forward to questions. Thank you for this opportunity for the presentation.